Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about lymphedema. So most people understand the circulation system, the blood flow from the heart to the rest of the systems of the body through veins, arteries, and capillaries. Well, there's a almost parallel system called the lymphatic system, which is a network of tissues and organs that help the body get rid of toxins, remove the toxins, waste, and other unwanted materials. The lymphatic system transports lymph, which is primarily consistent of infection-fighting white blood cells. And they actually go through the whole body, throughout the whole body. But when this system starts to fail, so you can get edema from blood flow pooling in areas where the blood flow is not getting back to the heart like it's supposed to. And we've talked about that in the past. But lymphedema is a very similar problem where the lymph is not flowing like it's supposed to. So it's pooling in areas either because of damage to the lymphatic system or blockage. And either way, it's causing pretty significant swelling, and it can be one-sided swelling, unilateral swelling, or it can be bilateral or both sides swelling in the legs or arms. The most common cause of lymphedema is, say, cancer treatment, where lymph nodes are removed and you can actually get some damage to the lymphatic system, and because of that, you will get swelling. So if you get a blockage or damage to this, you get the swelling. It usually can be really significant swelling in one leg or both legs, one arm, both arms. It can be very, very painful and can cause pretty good discomfort. It can cause a heaviness or an inability to function normally, depending on how it presents. There are also forms of infection that can happen that can actually cause a blockage in this system, for example. So treatment, what are the options? What are the things you can do for this? The most common treatments for lymphedema is exercise, wrapping, so you can actually do a tight wrap that pushes the fluids out of the lymphatic system to other areas. Massage, I guess those are really the most common. But the idea is you need to help resolve this problem and get it going. So one of the treatments that we've seen that works quite well is a sequential compression, where you're compressing at the feet, then you move up the leg, and then you do it through a sequence. So it's like massaging the fluid out. Similarly, a massage in that fashion can also work pretty well with that. So if you have significant edema, you have a significant swelling of the legs, and you're trying to figure out what's going on, you should be evaluated for edema or lymphedema, or congestive heart failure is another cause of, say, an edema type situation. So this is Dr. Brandt Gibson. This is your Podiatry Tips, Day 85, lymphedema, which is blockage or interruption of the lymphatic system that can also cause edema in the legs, in this case called lymphedema.